Well, let's go in here and see this patient. I don't see no chicken McNuggets in that ear. Let me look in this ear, see if you have chicken McNuggets. Make sure there's no chicken McNuggets.
Dr. Desmond Carson has patched up Richmond residents for decades.
My mission is, and has always been, to provide health care to this Richmond community. Listen to your heart, man. Man, you got a good heart.
But it's gotten harder and harder for doctors like Carson to make sure Richmond residents get the care they need. Carson worked for Doctors Medical Center in San Pablo for more than 15 years. The hospital served a community of more than 400,000 West Contra Costa County residents until it shut down in 2015. The day it closed, Carson and his staff moved across the street to a newly opened urgent care run by Lifelong.
Okay. Aquí tiene. Tome asiento y le van a llamar, okay? La muchacha me está tomando las. ¿Mande? No, está bien.
Sophia Waldron, who runs the front desk, says they're working with far less resources in a much smaller space, even though the community's needs are the same.
We're the only hospital nearby for people to get to that cannot drive. And there's a dire need here for a hospital because now we're congested. All the clinics around are congested. We have longer waits.
The closure of the hospital meant Richmond residents lost their one major emergency room. Besides Kaiser Richmond, which only has so much capacity, the nearest emergency rooms the community relies on are more than 10 miles away. Lifelong staff say they do what they can in the urgent care to treat illnesses and get people back on their feet. But it isn't an emergency room.
We're still struggling. We're struggling every single day. And if somebody comes in through our doors with a gunshot wound or stab, we address it immediately. We call 911. We do what we have to do to make sure that that person gets the care they need and are able to get to the place they need to get.
One of those places is Alta Bates Medical Center in Berkeley, a 20-minute drive away without traffic. But now that option is fading away. Recently, Sutter Health, which owns Alta Bates, announced it would close the emergency room in Berkeley and move those services to its Oakland location. Dr. Brian Potts, who runs the emergency room at Alta Bates, said this move is a necessary development.
You got to build to develop this new campus. That's going to take 9 to 10 years. There is no short-term switch that's going to happen.
Alta Bates spokespeople say the expanded Oakland ER would only be 2 miles further away. But some East Bay residents and community leaders argue the closure shouldn't happen at all.
To say that we will not let our community become a hospital desert.
If Alta Bates were to close, you're not going to have any emergency room to go to. This is an issue that's beyond Berkeley. It affects the entire East Bay.
She has such a strong grip, too.
Without Alta Bates, Richmond resident Michelle Milton isn't sure she or her baby would be alive. After months battling a rare and dangerous pregnancy complication, Milton gave birth to her child, Mariah, born 3 months premature.
It's a big girl. What is she thinking about?
After Mariah was born, Milton drove 13 miles every single day to visit her child in the neonatal intensive care unit at Alta Bates.
It did get kind of tough, especially all that traffic going down 80 or whatnot, but that was our only option at the time. We didn't have a choice, so we had to do it.
Every day, Mariah gets a little bit stronger, but she still faces serious health risks. Her mother fears what could happen in an emergency, being so far away.
There's nothing really close by or local where I can go get her right away. Even if I call the ambulance, it's not going to make much of a difference.
Like Milton, residents in West Contra Costa County feel they're being left behind. In the U.S., hospitals have been pulling out of poor neighborhoods for years. Since the 1970s, the number of hospitals nationwide has cut by nearly half, mostly in poor urban neighborhoods. More than 80% of Doctors Hospital's patients were Medi-Cal recipients, a patient base it wasn't making any returns on.
In West Contra Costa, the schools are f***ed up, the health care is f***ed up, and where if you move east of those hills, you have a Nordstrom's, and you also have health care. You also have good schools. Where there's money, there'll be health care.
In the case of Alta Bates, the community fears it's a similar story, that the closure of the ER is really about saving dollars. But Dr. Potts says it will benefit both the community and physicians to have one big emergency room.
We're looking at the largest emergency department in the East Bay. It would serve about 100,000 people a year.
Sutter has argued that having things centralized is better for patient care. But if you live in San Pablo or El Cerrito or Richmond, and you're driving on the I-80 corridor and it's backed up, every minute, every second counts.
For Dr. Carson, it's a reality he's already come face to face with when Doctors Hospital closed.
A good friend of mine, his wife has a heart attack, chest pain, pressure, heaviness. I humbly believe that if we were open, she would have had a fighting chance. Time is muscle. Your heart is a muscle. If you can open the blood vessels that go to the heart quickly, then you can save that heart tissue. If you can't save that heart tissue, you can't save the heart, the patient dies. My friend's wife had to go, she was dead before she got to Alta Bates.
It's hard to say exactly how many lives have been cut short because Doctors Hospital wasn't there. But Dr. Carson says he sees the impact every day.
I can go on forever with who got shot, who had a stroke, who didn't make it to the hospital, who didn't have transportation to the other hospitals around. We deserve to have a hospital.